Hello, everybody. Thank you for joining us today. My name is Fide Pineda Sandoval, and I will be helping today to facilitate our webinar on strategies to improve staff retention in health center settings, brought to you by the National Center for Health and Public Housing. Before we begin, I'm just going to go over a few housekeeping items. This is just a reminder to everybody that all participants are muted upon entry. If you have any questions or any concerns or any promising practices that you would like to share with us today regarding today's topic, please make sure that you engage in the chat. You can also raise your hand if you would like your line to be unmuted. This meeting is also being recorded, and the slides and the recording link will be sent via an email to all participants after today's session. This is just some information about the National Center for Health and Public Housing. The mission of the National Center for Health and Public Housing is to strengthen the capacity of public housing primary care grantees and other health center grantees by providing training and a range of technical assistance. And CHPH is a project supported by the Health Resources and Services Administration and is a national training and technical assistance partner that is 100% financed by this grant. The information presented today are those of the author only. So we're just going to go over some background information about health centers that are close to public housing. According to 2021 UDS data provided by HRSA, there were over 1,300 federally qualified health centers that served 30 million patients. There were also 458 FQHCs that are in or immediately accessible to public housing that serve to 5.7 million patients, and 108 that received public housing primary care grantee that were public housing primary care grantees that served to 911,683 patients as well. So this is just some public housing demographics data according to 2022 HUD Resident Characteristics Report. There were 1.5 million residents, 2 persons per household, 38% that were disabled, 52% that were white, 91% that were low income, 43% that were of African American descent, 26% that were Latinx, 19% that were elderly, and 36% children. 32% that were female-headed households with children. Now I will pass it on to Dr. Jose Leon, who is our Chief Medical Officer.
Thank you, Fide, and good afternoon, everyone. It's always a pleasure to be part of these conversations, and I am very pleased to be with Zara Marcellian, who's been with us discussing this important topic for the last few weeks, as well as Fide Pineda, who is our Training and Technical Assistance Manager. So today's webinar has 3 objectives. First, we are going to describe challenges to retain competent staff in healthcare settings. We are going to explore strategies to improve staff retention in primary care. And we are going to engage in a promising practices discussion to improve staff retention. So be ready. If you have any questions, please make sure that you have them ready for this discussion. There will be an opportunity in a Q&A portion to have a conversation on what is happening in your health, in your health center, in your state, in your community, and what you're doing to address this workforce issue. Next slide, please. And so we are going to warm up. We are going to do some calisthenics. And I just want to share with all of you a recent survey conducted by the New England Journal of Medicine, the Catalyst magazine, and specifically showing that the workforce issue is not only a U.S. Issue or something that is only happening in the US, but is happening globally. That WHO, PAHO, and the other organizations that are looking at this crisis are very well aware of what is happening. And sometimes we need to understand that it's not only the US having this issue, but it's everywhere. So in this particular survey, they interviewed 951 people, most of them part of their advisory group, most of them located in the United States, around 570. But they had also subject matter experts around the world, and they also interviewed 381 people. So as you can see, the staff shortage is an issue everywhere, specifically when we talk about clinical staff. And there is a significant issues when you compare the United States and the other part of the world. The issue is more prominent, or we need to take a close look at what is happening with nurses and what is happening with advanced practice providers, like nurse practitioners. In regards to physicians, the comparison is about the same, what is happening outside the US and what is happening in other countries. Next slide, please. So this is probably an issue that is not happening in your facility. But in some places, because of this shortage, some organizations are turning patients away. So the problem is more likely to happen outside the US. However, there have been some issues and in the United States as well, where some patients are turned away either daily or a couple times a week. Next slide, please. In regards to the roles, again, the issue is worse when we compare nurses and when we compare nurse practitioners and physician assistants and clinical leaders in the US. These are the groups based on this survey that are being affected, and we're talking specifically about the clinical staff. Next slide, please. Burnout has always been mentioned, by the providers, and this is a huge issue for nurses, physicians, nurse practitioners, and physician assistants, and even executives. So we need to make sure that is my understanding that everybody is trying to focus on this issue and how and providing some strategies and some promising practices to address the burnout issue and the exhaustion that is happening in primary care. So next slide, please. In regards to the biggest contributors to clinical exhaustion, there are the very first three are staffing shortages, unsustainable workloads, and administrative burden. And this is for the global, the US, and the outside US. So this is an issue that is happening globally. Next slide, please. In regard to pay incentives, and specifically the question is, how has the use of incentives for the following roles in your organization changed from prior to the COVID-19 pandemic? And all these incentives have been used by most of the organizations, specifically for those groups that we mentioned that have been highly affected by these shortages. Next slide, please. Now, I was curious and I was very when I saw this slide, sometimes we tend to believe that because we offered pay incentives, that this is something that is going to really solve some of the issues. However, as we can see on this slide, this based in the United States, only 3% said that is extremely effective, and 30% and 40% said that this is moderately effective or slightly effective. So this is a slide that really grabbed my attention. Same outside the US. So the issue is not only solved by incentives like this one, so we need to make sure that we address other needs when we are trying to have our staff. Next slide, please. So in regards to recruiting clinicians and employees, what is working and what are the most effective approaches? These people who were interviewed said that wage incentives, flexible scheduling, professional development opportunities were the first three that they mentioned. These always are, these strategies are helping people in the US and everywhere else. Next slide, please. In regards to retaining clinicians and employees, the most effective approaches that they mentioned to retain healthcare clinicians and employees, again, wage incentives, flexible scheduling, and improve work-life integration. Next slide, please. Now, in regards to how difficult it is to recruit the following roles at the organizations, again, many, if not all of them, mentioned nurses and clinician leaders, and even executives were mentioned as some of the main roles that are very difficult to recruit, or people who are difficult to recruit in primary care settings. Next slide, please. In regards to nurses, we know that this throughout the slide we've seen that this is they are the most difficult to recruit and to retain. So it's not surprising to see that when they were asked how difficult it is to retain, the nurses, 89% in the United States said that is quite difficult. Next slide, please. And this is another one that is, when we compare outside the US and the US, the question on what is the likelihood that you will leave your current job within 2 years, I was quite surprised to see responses like 23 and 25% in the United States. They said that that is something that they are considering. There are likely 18 and 18%, and a definite answer was provided by 14% and 11%. So this is a public health issue and a public health concern for everybody. Next slide, please. And as a result, we've been talking and discussing this issue with someone who is always an honor for me to talk and discuss all these issues because of the expertise and the support that she provides to other health centers. And so today we're going to hear again, and this is the second webinar of a webinar series that we have. In case you missed the first webinar, we invite you to visit our website, www.nchph.org. And for this particular webinar, we are also having Dr. Zara Marselian. She is the founder, president, and CEO of La Maestra Family Clinic, and a health center that serves approximately 45,000 patients annually in San Diego County, California. Dr. Marselian is an award-winning author, a well-regarded speaker, and an international consultant. Dr. Marselian also serves on numerous advisory boards, and for more than 36 years, she has developed programs and services that meet the community's needs. Dr. Marselian developed a holistic solutions-based model to address overall health and well-being for all patients, regardless of their ability to pay. The model known as the La Maestra Circle of Care provides primary and especially healthcare and social services to address the social determinants of health. Services include an on-site food pantry, housing, microcredit and micro-enterprise programs, job training programs, after school and summer programs, outreach, health education, environmental health, case management, and public program application assistance. So Sarah, good morning to you.
Good morning, Dr. Leon. Thank you so much for that really nice introduction. I'm hoping that today we can share some ideas, new concepts perhaps, and provide the participants on today's webinar with some, motivation or ideas on what they could adapt their retention strategies to encompass that might work better with the given shortages that you discussed in the introductory slides. So thank you, and I look really forward to being able to share some of our experiences and perspectives. First, I wanted to explain a little bit more about La Maestra. Next slide, please. Okay, next slide. This is La Maestra Circle of Care that Dr. Leon was describing. We grouped the services by color, all of the medical, mental health, behavioral health, imaging, dental, clinical services are in red. Then you have the other groupings around economic development, housing, supportive services, social services, youth development programs. All of these have been developed over, I would say, 36 years in response to what the community needs and what they feel is, what they present with. In other words, their history, whether they're coming in as a patient and during, providing the medical history, speaking with one of our support staff or the providers, then, they are definitely going to share about lack of food scarcity lack of food in the areas that they reside in, because many of our communities we serve are either food deserts or food swamps. And that's all connected with our health education. All of this is integrated in the primary care model with social determinants. And those social determinants that we've created are because they don't exist to the extent necessary, or our populations do not have access. They're not eligible for some of those programs, which is why we grew them ourselves, obviously in collaboration with other partners. So I just wanted to, that's how our legal advocacy program, which is now family law, we have immigration, and other, family related legal issues that we help people with. And our populations are they're extremely culturally diverse. Next slide. If you could see, yeah. So we have, for example, 55 languages that are spoken by our employees. And why? Because we hire from within the communities. All of the populations we serve in our circle of care are extremely culturally diverse. We're on the border. We're within the border zone. So that's within 40, 50 miles of the international Mexico border. We have 21 sites in 4 San Diego communities. And we're also in the schools. We're in 3 different schools, and we have licensed mobile clinics that participate then in other school districts that are further out. And, with our community-based organizational partners that we have through these sectors, all the sectors I mentioned that we work through in our circle of care. So it's not just collaborations with healthcare industry, it's with the food scarcity, it's with youth development, it's with transitional housing, and on and on. And so when I'm talking about retention, it's for us, it's really looking at the employees around the whole circle of care, and what can we do to strengthen those strategies to retain qualified and passionate workforce. Next slide. So some of the challenges and employment trends that we've noticed that many others have experienced as well, and there's plenty of articles on it, is that we continue as health centers to face competition from hospitals and even larger health centers. So during COVID, after COVID, pre-COVID, there are always these cycles of, our nurses being recruited from other health centers, larger health centers than us, because they can pay them more. It sounds like it's more prestigious because it's a larger health center. Whatever the, the reason, it's usually one of those. Or during COVID, the staff we had working remotely moved to other cities and states during COVID, or even just to the rural areas here in San Diego. So it makes it hard for them to come in to work, and they, they continue to request to have, like at least 20% of their work week by remote. So that's something that I know we'll all continue to work with. In 2021, we saw the Great Resignation. Later on in the slides, I've provided you with some citations, resources that speak specifically to the fact that the Great Resignation is not over. So we'll get to that. Quiet quitting in 2022, minimal performance, people that are not really engaged, career cushioning. We're still seeing that, where you have people that are in the job, and but they're constantly tracking what other job opportunities are out there. Then we see quiet hiring, managers tasking star employees with additional roles without increased pay versus hiring additional staff. So these are all like unintended consequences that, have arisen because of the huge changes people have gone through the pandemic, adjustments with their own life, with their own family. And many times, the families have moved out, from one state to the other. And it really, I think the changing everything in your schedule, in your work, your children's schools, really emotionally, mentally has caused our workforce to really rethink what they want their lives to look like. What kind of life balance do they want? Emerging from COVID, post-COVID, and, not to mention all of the burnout and the fatigue and COVID fatigue and so forth, that, we continue to see. So really coming up with strategies to identify and work with the workforce and support them, as we see throughout the presentation, is vital to retaining your workforce. So then we deal with the other stressors. Post-COVID work-related stress was reported from 3 out of 6 employees. This was according to the American Psychological Association. Then we have the effects of inflation. 87% of Americans are concerned about inflation, and 7 out of 10 employees concerned with that their pay isn't going to be enough to meet increased expenses. I've provided you with the citation on that. So we know that, workers really want, they want more pay, and they want more benefits, and they want to feel like, where they are choosing to work is meaningful to them. It aligns with what they think or they feel that their purpose is in life. They want to be part of that social impact, a positive social impact that many health centers have on the communities that they serve, because they are that supportive network. They're not just, providing the service, a trip to the doctor today, but oftentimes they are that supportive network for the communities to access resources of information, services, and through partnerships, being able to work those pathways in the organization's network for, external assistance through these partners. Next slide. Okay, and then here's, I provided one by NAC. I thought that was really pertinent. And it kind of echoes a lot of what Dr. Leon presented from the global perspective on workforce shortages. And this recent survey is that 68% of health centers reported losing 5 to 25% of the workforce during COVID. 15% of health centers reported losing 25 to 50% of the workforce. And the highest ranking reasons. Well, there we go. Competition from larger healthcare organizations, post-pandemic stressors, searching for professional growth, childcare issues, or they just left the healthcare industry entirely and they switched careers to another industry. They didn't agree with the vaccine mandate, or they're continued to be concerned with potential infection exposure. So the highest turnover rates in these job categories, again, aligned with the introductory slides that Dr. Leon presented. Nurses being the first one, administrative staff, behavioral health staff, dental staff. We at La Maestra have seen, the also shortage in primary care providers, definitely nurses. And this is, really concerning. I was also on I was attending a course through the American College of Healthcare Executives last week, exactly. And some of the hospitals were speaking about their being so concerned with the shortage of nurses that they are now re-looking at the models and seeing, and really considering putting a robotic nurse on the floor with the other RNs, because they can't keep up with the demand. The patient numbers are always going to be there, but they say they just don't have an answer to, finding enough nurses to be able to do the work. So I'm not saying all hospitals said that, but I was really surprised to hear that. And we'll be following to see how that works out for them. Next slide. So I thought we could put this into perspective, at least share what we have seen. In 2023, that's January through now, we had an overall turnover rate at La Maestra of 8%. Now, this is very different from the years during COVID, from March 2020 to December 2022, and the turnover rate was 24%. And the reasons that we analyzed why the workforce left was, 10% moved out of state, 20% didn't see opportunities for advancement. Now, that doesn't mean that there are not opportunities for advancement. It meant to us, when we analyzed these rates, that we must not have done a good enough job to make sure that the employees that are there and want to continue their education and their learning pathways can see themselves staying at La Maestra with a good opportunity when they do get those additional certifications, degrees, advancements, trainings, and so forth. So these were all good information, good data for us to see. 20% childcare caregiver issues emerging from COVID. 30% was because they wanted more money, they wanted more benefits, and 20% because of health issues, either themselves or their family members. And the Great Resignation is not over, according to the World Economic Forum. This study shows that most employees do want higher wages, and 2/3 of those desire more fulfillment from the workplace. And this means to us that we need to do a better job during orientation, especially with employees, explaining not just what their job's going to be, but how the mission operates and how our workforce really contributes to that positive impact in the communities we've served. So employees can see, okay, so I know this is the job I'm going to do, but like, who cares? Is that just, it could be me, or tomorrow I could be replaced with somebody else and the work would still be done. What extra am I going to be able to bring to my work that I've done here at this nonprofit? And how am I part of the bigger goal, the bigger picture, the bigger mission? And does that feel good to me? What does it align with my purpose? So this is something that we really, I think, as nonprofit health centers need to pay attention to. How good of a job are we doing to make that connection for our employees during orientation and subsequent opportunities. There was another link I shared, Pew Research, people feeling that there's no opportunities for advancement. Again, they mentioned lower pay, that they felt like they needed to get more pay and feeling disrespected. Next slide. So this is, I wanted just to describe our talent management program and why we formalized it and what we've done to add on to that. So in 2017, I was studying for my doctorate at the University of San Diego, and I met, a lot of colleagues, students, faculty that were interested in studying more about nonprofits and how they manage their employees, their workforce, and the talent management theories. And so what ended up happening was one of my colleagues said, hey, could I choose your site to come and do this study, my research study for my doctoral program, and see what La Maestra's talent management program consists of. And during that process, which we said, sure, that was awesome. During that whole process, the findings, it really led to some eye-opening concepts, observations that then we put into motion. And that formed our talent management, didn't form it, it really kind of started us thinking, okay, so here's a concerted effort. We want to address these issues. This is what we think we're hearing, we're seeing through the data, and maybe these are some strategies that we could employ. So number one, La Maestra's talent management program, it starts with the recruitment and really robust recruitment. Orientation, also training, evaluation, career counseling for retention, advancement, and certification. And we'll get more into this in the presentation, but that is seen as a huge benefit from our employees, is having the ability to really meet one-on-one with the employees, finding out what their goals are, what their dreams, their aspirations in terms of their career, and how can we as the employer help them get there while still remaining at La Maestra. And it's a win-win-win all around. Doesn't always work, but I'll share some of the findings with you. The robust orientation I was mentioning for new hires, that does promote retention. And also during that orientation, how could we promote more our organizational culture and opportunities for the employees to be part of that positive impact by sharing with them, the new recruits, look, this is what we've done over how many years. I think this is, very measurable, and some of the successes of the organization. And one of the successes is the development of this comprehensive integrated model. So the in-house career center that we put together for retention and advancement, we'll talk more about that. Robust employees benefits, in-house residency programs. We've established in-house training programs as well over the years. Developing pilot programs with local colleges, universities, such as the track from medical assistant to LVN to RN. Working with foreign providers is a way to retain them if you're sponsoring as the employer, the immigration status or the visa for them, they will stay. Teaching health center, graduate medical education, and accreditation. That's something I shared on our webinar, the first webinar, which is that, La Maestra has been granted this, and we're expected to be able to start with these additional residents July of this year. And hopefully the more residents we bring in, the more retention, rates we can see with those providers. National Core, the Nurse Corps Scholarship and Loan Repayment Program, as well as the National Health Service Corps. Again, bringing more opportunities in terms of workforce, helping with the training up front, seems to be very beneficial, and it affects in a positive way retention of those employees. Next slide. So part of this whole, looking at the talent management, seeing the results from the doctoral study, we again looked at in the turnover rates and really went through those exit interviews. The questions that people fill out when they leave, why did you leave? Why are you leaving? What could we have done better? What did you like best? What didn't you like, very much? What would have kept you here? What would have convinced you to stay? So really looking back and analyzing and thinking about the reasons, and do we notice any trends? That information, that data really informed our strategies moving forward on what we were going to implement and try to see if it would help us with the retention rates. We also collaborated with the educational institutions to create pathways for employees. So let's say that in the staff survey here, we'll talk about the staff survey that we sent out to all the employees, asking them some basic questions about their interest in continuing their learning objectives and their learning trajectory and certifications, and what are they interested in, and then following it up with staff interviews really helped us then identify, okay, X percentage of people have identified that they're interested in going from PSR to MA, or MA to referral clerk, or MA to LVN, and they're on those tracks. Then it was our job to really look around and speak with the educational institutions in our area to see what programs did they offer and how to best connect people. And is that going to be through, virtual? Is it going to be part of the time in the classroom, part of the time virtual? And what is it that the employees end up with in the end? And is there a way for us, the employer, to help subsidize that? So this is what we have found out, that, so far, just being able to do those surveys and speak to staff, and individually and by department, they really seem to light up at, somebody asking, so what are your plans? And, how, what programs have you attended before, or what licensure do you have now? What interests you in the future? All of that is additional attention and concern and care about the workforce. They feel like somebody's interested. And even though, we're not going to have all the answers to what they might want to continue to study, at least we're helping to bring up the issue, and for them to know that we as the employer are supporting them in their desire to further their career, and that we care about them and we're going to help them as much as we can. And then, so it's also helped us to avoid these, burnouts and people feeling super stressed, the employees, if they have some newness in their life where they feel like, yeah, there's a lot of things that have changed, caused them stress, but look at these new opportunities that they can think about, that they can explore, that we're helping them with, then it kind of adds to their mind, I think, that this is really a benefit. And they're learning as they're working. They're learning something new as they're working. So also it enhances the workplace experience. It speaks to employees' purpose, the belonging, the inclusion. Why? Because somebody cares about them, not just as an employee filling a slot, but they care about their health and well-being, just like we do with our patients. And of course, that this whole process involved, our board being very supportive with us proposing that we adjust the benefits and the wages. Of course, we've done that. We do that periodically, especially during and after COVID. However, we can't keep up with the competition from the hospitals. There's no way. So no matter if we adjust or not, it's still going to be, you know, an issue moving forward with retaining our nurses, our providers, our dentists, and so forth, if they can join, you know, higher, I would say, larger health institutions and get paid more. So we can counteract that with these kinds of benefits of really caring about the staff and helping them move forward on their career development. Next slide, please. What we used on the survey was a very simple Likert scale survey to measure how employees were interested, how much were they interested. And so we took them, you know, those that said strongly agree, agree, not sure. We then followed up with these employees to do individual interviews. So with the Likert scale, we got the quantitative data, and now we followed up with the interviews. So that's the qualitative data, and that's provided us with some really good information. So it's out of 790 staff, that was including 110 providers, so we took that percentage out. 37% then responded to the survey initially. No providers responded. And the majority of the respondents were from entry-level positions. 41 desired to study pathways to nursing, was starting with MA, then LVN, then RN. So then it was up to us to figure out, okay, who are the academic institutions out there that have that pathway or would want to pilot with us on creating one. 20% of those respondents identified the desire to move laterally, study something that was similar to their educational experience that they've achieved so far. And then 39% said, you know, they're interested in improving their career and advancing their career and studying something, but they just didn't know what that was. And they were interested in learning more. And that's then when we really mobilized our leadership team, our HR, to bring together these partnerships that to this whole question, right, of where can employees go to further their education in the tracks that they have identified. Next slide. Okay, so again, you know, in the interviews, we were able to delve more into, you know, what's their current level of education, what have they completed, the best fit modalities for them. They're going to be, would they prefer, you know, more remote? Would it be easier for them if their coursework were to occur, the classroom hours were to occur at La Maestra site, at their employer site, because it's easier to get to? Did they have issues of transportation? And what else needed to be addressed before they could enroll and pursue their objectives with learning? Some of those were, you know, they had to find answers about childcare and what they were going to do with the kids while they are continuing to study, and kind of work through some of those, you know, situations, and depending on what their hours were as well. Part of this whole process showed us that under lessons learned that many of our entry-level staff had already started trying to attend programs for more certifications, training through vocational schools. This is sometimes before they even came to La Maestra or during COVID, but they weren't able to complete it. So they still carried that financial burden of these student debts. And that was really sad to see. That meant that, you know, the solution we were going to help them like pursue to continue their education was not going to be to shoulder much more additional debt. It was something that it had to be some other opportunity for them to you know, to participate, and for us as the employer to subsidize part of those costs. And then through the evaluation process for our employees, we also really I think, expanded on the section that talks about what are the employees' goals, their future goals. So we're able to capture the data from the survey, from the interviews, the individual interviews, and then also as part of their annual evaluations, make sure that the supervisors are filling out and discussing with their staff, what is it that they're thinking? What is it that they want to study, or what career are they interested in, especially the young youth or the workforce that we have. It's really important for the supervisors to also be part of this process. And so the evaluation, during the evaluation process, that is where we see that supervisors can be really effective in helping and encouraging the employees to think about their future goals. So next slide. Okay, so the sharing some useful tools for the formation of a career center. If that's something that you are interested in exploring, just finding out what's involved. And we had our some of our staff initially, when we thought, okay, we need a career center. Where do we park it? Is it going to be a separate unit? Is it going to be part of HR? What helped us decide all of that was going through this online training through the Markle Foundation Career Coach Training online. Also looking at some of these other resources and seeing how it's possible, how it's doable. You know, at first it seemed to be so overwhelming, like, gosh, you know, how are we going to step up and really do this work and spend the time one-on-one with the employees to do this identification of what is it that they want to do, and help them along that process and follow up to see, did it work out? Referring them to one of the community colleges or continuing education or the university partners we have, depending on what they wanted to do. Like, it just seemed like overwhelming, but we just started piece by piece, and it just grew. And now we have, I believe, 2 full-time staff dedicated to this process of still following up with employees and continuing to, you know, to work off of those surveys and the interviews that we had with the employees and the referrals, and see what ended up happening with all of that. So these are some of the other links that I think are really very informative as you are thinking about, okay, what is it that you want to do with your employees? Do you want to get into any of this workforce retention strategy in this manner, or other ideas? These are some of the tools. I think they're really helpful. Next slide. Again, here are some great resources on career coaching, also funding opportunities under the Department of Labor, the ETA. Also, NAC has put together a really good digest for recruitment and retention, with specific examples of health centers across the nation who have incorporated on-site programs, training programs in-house, and work with different universities to then be able to offer the accredited, you know, certifications, trainings, certifications and degrees. Also, Career One Stop is another great opportunity for getting more information on this whole topic, and what you could be able to access there in order to counsel your employees. Getting the right staff, finding the right staff who are really interested, not just for building the workforce, but that have a real desire to help, bring more educational resources. We're really blessed to find some really, I think, skilled and dedicated older people that had been working with the universities, colleges for years from a teaching perspective, and also doing some real career development. So we were blessed to find them. Otherwise, I think that would have been hard to accomplish. to set up our career center in-house with the current staff that we have. So these are some ideas. Next slide, please. I'm just checking the time here to make sure we do have enough time. I wanted to give you some examples. So this is the another area that's really important that we found are these soft skills and the gaps of soft skills that we see in our workforce, especially the younger workforce that don't have as many skills that it could really benefit them in terms of communication, collaboration, time management, critical thinking, managerial skills, adaptability, teamwork, problem solving. And why? Because they've had, 3 years, maybe or 2 years working from home. They haven't had as many years interacting personally, in person, with other staff, with patients, with the customers. And maybe, maybe they're behind because of that. Also, with all of the misinformation from social media, we see a lot of younger employees that watch social media that advises them, oh, this is what you should do. You should put together this, proposal and go into HR and say, I really think that I'm worth, $40 an hour. I just started working, but this is what I think I should get, and you should give it to me, and so forth. And it kind of builds them up, and it leads them into this environment of not being in reality, and it does them a disservice. So that might have something to do with it. In any case, if you have a significant percentage of your workforce that do not have their soft skills down, then it's going to affect their ability to even pursue their own learning. Like if their writing skills are not proficient enough to be able to take on assignments that are given to them through these coursework and trainings, they're going to feel overwhelmed, and they probably, are not going to excel. And we want to set people up to excel and succeed. So we found these opportunities here available through our continuing education partners that will do a lot of the training that we've talked about here on soft skills, in addition to English proficiency levels, helping people with their English as a second language programs, their vocational English as a second language skills. Perhaps some of the employees had never finished their GED. This is an opportunity for them to go and finish this. And again, a lot of this is offered online, and it is free. So that is an example of an awesome resource in your community that you could tap into and make that connection with them, and then establish that pathway of referring your employees that need this and recognize that they need it, and want to develop more of those skills. And these are some of the other citations I've listed around soft skills and bridging the skills gap, and why we as an employers have to do that. A lot of the articles you'll see also talking about retention really refer to reskilling, upskilling, and soft skills. That's all true. We also have employees that they already have a lot of skills. They've been working in the area for many, many years in this job category. They love it. They bring a lot to the workforce, but they don't have additional certificates demonstrating that they did achieve those levels of understanding. So when I'm looking at our educational partners, I'm also asking them, so what exams do you have? What skills do you require? Let's say somebody who's been working already in this kind of position for a long time, but they don't have that certification. Is that something you partner could help do for our employees in our workforce? So that's another reason why continuing education, community colleges, that's an awesome place to start. Next slide. These are some examples. I already mentioned some of the certifications that we work with through the colleges of continuing education. Community colleges, again, they can offer certifications, degree, network development. So your employees then have other like a support also through their classes, of people they meet, and ideas and concepts for growth. Universities as well, certifications, degrees, network development, and then any pilot programs that perhaps your site as the employer could partner with one of these institutions or all of them, saying, look, we can offer this space at our sites, for in-person course required attendance. We can offer that space here, make it easier for your employees, and then subsidize some of the hours for the courses. So what we've done is we've had like 2 days a week, maybe 2 hours one day, 2 hours another day, that so that's 4 hours that we as the employer have subsidized for that employee, so they didn't have to go work the full work week and then go and figure out childcare for their kids at night to go back to some night school or night program. And then Saturdays, that would have been overwhelming for the employees. Saturdays they could also attend virtually or in person, and that's on their own time. So it's, again, establishing what works for you, the employer. What could you possibly offer as a subsidy to your employee? All of that's really important. Then I have a link there for registered apprenticeship programs, specifically in the healthcare field, that you might want to look at, especially if you're in a rural area. If you are, and there's also retaining skilled employees section in that link as well, once you get into the website. And there are programs specifically for veterans, for people who've been laid off, folks that live in rural areas. You might want to check that out. And how difficult or easy would it be for you to have a registered apprenticeship program? Next slide. I know we just have a few more minutes here, but I wanted you to be able to look at this. Some of the suggestions that we have around mental health. Mental health is for our employees, as again, creating an acceptance around mental health, helping employees having those resources available for these coping skills and life balances, especially emerging from the pandemic and all of the changes everybody's made. And what would that work-life balance be like, and how can we as the employer encourage them to take advantage of these resources, and not just of mental health, but also some of these SDOH resources that we offer our patients. As you can see, also we have the YMCA collaboration for exercise. Any community partnership that you think would be beneficial for your employees to participate in as well, I encourage you to explore that. On the bottom, the enhanced well-being programs for employees around exercise, nutrition, counseling. Next slide. Also, health fairs for employees specifically that we offer at work. Well-being activities at work, walking during lunchtime, or participating in some educational event for around specifically different job categories. Also working with employees on how to provide this flexible work schedule, considering the childcare and family obligations they have. How many of our workforce do we still want to continue on the hybrid remote positions? What makes sense, but know that employees really do want to continue that, having some hours per week that they work remotely. That's a benefit. Another interesting opportunity for us, a lot of our employees said, we really want to learn how to sew. We really want to do art, music, community gardening. So we have put those together. Again, that provides that support for the employees, an opportunity to engage in activities that speak to the life balance, life-work balance, and build more support with their fellow employees. And then we ask our vendors to give us, free tickets to the to baseball games, and people really love that. The workforce love it. So we continue with that. And of course, talking about the volunteer opportunities that we have available for our employees to participate in. like our toy drive and food drives and drives for the treatment centers for folks in recovery. Next slide. I'll leave you here with this financial well-being, and actually there's a couple more slides. We definitely have, looked at and been engaged in a lot of this on a continuous basis, providing the resources for our employees through partnerships with financial institutions that can come and offer them financial coaching, planning, retirement. We also offer the FinFit, which is a short-term emergency loan program for our employees. We allow them to cash out sick and vacation hours that they have accrued, budget allowing, of course, and the 401 employee benefits education, and then the career counseling and the resources leading to certifications and advanced education, which increases their earning potential. It is definitely an area that employees identify as contributing to their well-being and their happiness, and they're wanting to stay with the employer. Next slide. Okay, so promoting the inclusion. Again, we get back to the beginning of the presentation, which is this all speaks to enhancing the employees' feeling of being included, belonging, feeling like they fit in that workplace, in that organization that they have now joined, and feeling like it's worthwhile. It makes them feel good. It meets their intrinsic needs. So this is definitely, some articles I provided here for you and ideas to consider. And to please make sure to look at NAC's Workforce Wellness Toolkit. It's really extensive. We have not incorporated all of it, but it's definitely something for you to look at. So thank you so much. And I really hope that this webinar has provided some new ideas, and especially, now that we see, HR has become a much more sophisticated and complex function to the organization. Its charge is to effectively manage our most important asset, which is the staff, right? So the workforce today requires an expansion on the HR model utilized in previous years. And we need new strategies in the recruitment, retention of employees. It's extremely crucial. And moreover, the philosophy about HR functions has really evolved also. No longer can we just wait for, people to present, right, that are matching and aligning with our organization. There's a good organization fit. We have to be part of the preparation of that workforce, the educational preparation, and the mindset to work in nonprofits and healthcare organizations. So thank you so much. I hope this has been useful. I'll turn it to you, Jose.
Thank you, Zara. Thank you so much for this great presentation. We are over the hour, but if you have any questions, if you would like to ask a question to Zara, or if you would like to ask me a question, that we are here. Before you jump off of the call, there is a survey. Please fill out the survey. Your feedback is always useful for the National Center for Health and Public Housing. Fide, do we have any questions?
Yes, so during the webinar, while we were having the presentation, we got a question from Amanda Berry, and she was referring to the graphs that you were going over earlier, Dr. Leon. How do you make sense of the two slides about wages? One said wages are a top factor, and the other says only slightly impactful.
Yeah, that's a great question. There are a couple of things regarding the survey. First, the survey, if I'm not mistaken, the question was on whether or not health organizations have used the wages and the incentives as one of the strategies to retain staff, and the response was that there was a high percentage of organizations that have used it. However, the other one, the following slide, was whether or not that strategy was enough you know, so what they said was not enough. So that's the difference between the two slides. The other thing that we need to consider, and in my opinion, this is a limitation of the survey, is that the survey was conducted a year after COVID, when COVID started. So if the incentives probably, you know, even you were offering, or these people were offering, or these organizations were offering incentives, the incentives were not enough to retain staff during COVID.
Mhm. All right. Well, thank you so much, Dr. Leon, for that answer. And then on to the next question. The question says, what is a robotic nurse and what can it do?
Well, that was my question too, because I don't work in a hospital. But from some of the comments that hospital staff colleagues were offering on that course was, you know, apparently the robotic nurse can do a lot of the QI functions, obviously not patient care, but administrative QI functions. And that's what they were going to start experimenting with, because they just knew that they weren't going to be able to keep up with the need for nursing, you know, the nursing workforce.
There are several research studies, Zara, on that particular issue, specifically mentioning that they are going to be helpful now that we have the senior population growing. So they will be able to do some of the tasks, you know, probably not all the tasks, and but they are going to somehow reduce the burden, you know, to nurses in healthcare facilities. And that's something that has been with us, you know. I mean, when I saw the question, the very first thing that came to my mind was the Alexa, you know, turn off the TV. Alexa, do this. It's basically the same. There will be some basic tasks that will be provided by these robots, you know. And the other big thing is the artificial intelligence topic that everybody's talking.
Right. Well, I think you know, we're embarking on all of that and seeing, you know, where this could be really beneficial, and where this, you know, artificial intelligence can help fill the gaps in workforce. You know, unfortunately, I think we're going to also see some of the unintended consequences and complications that we don't even anticipate right now that will be emerging from or resulting from those interventions. So it's fascinating. I look forward to reading and hearing about it. Thank you.
Thanks, Zara. Do we have any other questions?
Nope, no other questions.
So once again, thank you so much for attending this webinar. If you have any questions, please feel free to submit your questions. Again, do not forget the post-evaluation survey. And we have our contact information here. If you have any questions, please feel free to either contact Fide or contact me. And if the question is for Zara, we will be happy to send the question to Zara. So once again, thank you so much for attending this activity, and have a great afternoon.
Thank you. And before we leave, thank you so much again. And also, we just received another question about the slides in the recording. And yes, everybody will be receiving the link to the slides in the recording via email in a couple of days.
That's awesome. I had somebody ask me for that the last webinar, but I knew that you guys were sending it out automatically.
Yep.
Thank you.
All right, thank you. Have a great afternoon.
You too.
Mhm.